It's the show where Hawaii's newsmakers come to talk and to take your questions live. From the nation's capital to Honolulu Hale, from the state legislature to the fifth floor. We bring the experts to you and ask them what you want to know. Spotlight Hawaii with Yanji Denise and Ryan Kalesuji on the digital platforms of the Honolulu Star-Advertiser.
Aloha and good morning. Thanks for starting off your week with us. I'm Ryan Kalesuji, joined by Yanji Denise, and this is Spotlight Hawaii on the digital platforms of the Honolulu Star-Advertiser. This morning, we speak to two individuals who are working hard with Governor Green and his initiative to help people off the streets.
That's right. The governor has said that helping the homeless in our community and those who are at risk of becoming homeless is one of the signature, proposals for him. It's one of the things he ran on. It's something that he championed when he was lieutenant governor, and now it is something that he is really bringing to the forefront. The legislature allocating $15 million for one of his signature programs for this coming fiscal year, and that is the Kohale program, $33 million for the fiscal year following that. So joining us this morning to talk about where that money will go and what these structures will actually look like is James Koshiba, the governor's coordinator on homelessness, and Nani Medeiros, the state's chief housing officer. Welcome to you both.
Thanks for having us.
So James, I want to start with you. Tell us, just so that folks sort of have a sense of what these are. We've been talking about them for some time now. As I mentioned, the governor did run in part on addressing homelessness with this as one of the tools in the toolkit. What is a Kohale? What are these villages supposed to look like? Can you give us some examples and what the vision is for these structures?
Yeah, so Kohale really is village-style, deeply affordable housing. And to take a half step back, I think the last time we spoke, we talked about the real solution to homelessness is finding long-term and permanent space, deeply affordable space for folks who are currently on the street to be housed and healed. And Kohale is one solution to this. What makes Kohale different is that right now, in order to create that deeply affordable housing, it's very expensive, both to build and to operate, which is why it's so hard to create housing that's affordable to people on the very bottom of the income scale. For Kohale, which are going to function like villages, the affordability comes from functioning and working as a community. So even though these are often envisioned as tiny home villages with shared bathrooms and kitchens between multiple units, a Kohale could be in a repurposed apartment building or dormitory or office space. The design is less important than that it's intended to function as a community with people taking care of the space and of each other. And with that sense of kuleana and the taking of responsibility for those community functions, we can keep the operating costs low and pass those savings on to folks in the form of very affordable rents.
And Nani, I want to bring you in here and your role in the governor's office. Of course, this is, we've had you on in the past, and you are entering a role that has been created specifically by this administration. If you can explain how the Kohales work into the overall plan that you are sort of mapping out with responsibilities that you have.
Sure. Kohale is one of the, I think, major legs or pillars of Governor Green's solutions to address homelessness. As James mentioned, having deeply affordable housing options for neighbors we're trying to bring out of homelessness or houselessness is really important. And to the extent that I am involved, it's really to provide some direction and support with James in the construction and development of the Kohale and working with our landowners, whether it's identifying government lands at the state and county level or private landowners who reach out and say, hey, I'd love to do a Kohale in my neighborhood. We've got a problem. I care about my community. I've also been involved in a number of those conversations. There's a lot of coordination that goes on between what I do on that and what James does. He really is deeply involved with the community and advocates, and it's to his credit, getting the funding that the legislature provided this year to support Kohale development. He went out there and really made the case and worked hard for that. So now it's kind of just hearing my side on construction and development and landowner discussions, and James's side of, looking at those areas. Where do we want it? What can we do? And coming up with the operating details for each of those Kohales.
Nani, let's stick with you for a minute and talk about a project that I think a lot of people have been able to see go up just in the last week or so outside of Queen's Hospital by the Department of Health. This is a different kind of Kohale than maybe some of the others that are planned. And that's sort of what makes this so unique that we want to talk to you about today, just that it really depends on the neighborhood that they go in, what their function is. But let's talk about those temporary medical Kohale in front of the Department of Health. Tell us about what your role is to that. And then James, if you would share what you're doing for that effort as well, and how soon you expect to have folks actually being able to use those spaces.
So the nonprofit Home Aid Hawaii is partnering us on the development and construction of our medical respite Kohale. I've been working with them, taking the lead for the state side on site plan and design of units, and overall, kind of construction of the whole thing put together. We've got builder team meetings happening every week. I talk with the core team daily. We text daily. I'm on site all the time to, see where they're at, see what they need help with, kind of coordinating the state's end with our nonprofit private sector partners. And right now, all 12 units are down. You're correct. We've got the hygiene center coming in, I think, in the next week or two. We've got some outdoor spaces that we're going to furnish and cover. And then the Kohale will be ready to be handed over to Project Vision and all the work that James has been doing.
Yeah, James, if you could talk about what you've been doing, and also this idea of having that community partner in Project Vision, that it's not just the state running this program, but that there's an outside help as well.
Yeah, I think that's an important point, because that's how we hope every Kohale is. As it's a partnership between the state and community organizations, community groups like Home Aid Hawaii and Project Vision in the case of this temporary medical respite Kohale. So we hope that's replicated in future Kohale as well. But this particular Kohale, as I mentioned, it's temporary. It's for medical respite. It's designed to serve people who are discharged from urban Honolulu hospitals into homelessness and who still need a space, a safe, clean space to fully heal and recover. And I think we're very familiar with seeing people, languishing on sidewalks around our urban hospitals. And this is designed to help address that need. So you mentioned Project Vision. They are the primary program partner for the state, although not the only one, but they'll be staffing the Kohale 24/7, both with healthcare professionals and with case management, site management, and security for this Kohale. Now, it's temporary because the long-term solution for this is to open up medical respite bed space out in facilities in the community. And we're working on that simultaneously. So I'm working with the hospitals and with other community partners to get bed spaces for medical respite, more bed spaces open up in the community. And as those bed spaces come online, the need for this temporary Kohale will diminish, and those units will then be repurposed at a permanent Kohale site.
Yeah, if we can just dive in a little deeper into that, because we often see how something will start off as temporary but become permanent over time because the need is still so great and there hasn't been any progress maybe made. As you look for these other venues that could eventually take the place of this specific Kohale that's across the street from Queen's Hospital, what are you looking for in those types of facilities? Is it a already existing hospital? Is it a community center? What are some of the criteria that you're looking for in order to become that more permanent solution long term?
For medical respite, the spaces fit both the categories you described. So in some cases, hospitals have space that they can open up. In other places, there are community-based medical respite centers that are set up and maybe are not functioning at full capacity yet. They have beds, but they may not have staffing, or they have resources but not the beds. So we're trying to get every one of those spaces opened up, bring those beds online. Again, not just the state, but with partners like the hospitals and those community-based providers, so that the need can be addressed by those spaces. And as I said, the Kohale units can be used for for permanent deeply affordable housing.
Nani, let's talk about some of the other sites where we could start to see these Kohale coming up. Tell us about the conversations you're having. This is a statewide initiative. The governor, I believe, on this program had said that he was hoping for 26 across the state. Where are you focusing that efforts, and what makes a good site?
I don't think that we are at a point yet where we can evaluate specific locations. We're still vetting a lot of things, talking to community, and I'll punt that to James in a second. But we have, since Governor has taken office, we've had groundbreaking for a Kohale on the Big Island in Kona, and we had groundbreaking for another Kohale just a week or two ago on Kauai. 24 units it's going to be a mixture of actually Kohales, what they'll start with. Then they will build workforce and affordable and kupuna housing around that project. At full build out, it'll have 600 units total. So we really are, looking across the state. And as I mentioned, I'm talking to a lot of private landowners have reached out and want to see if they can do something to help address homelessness in their neighborhoods. But to be honest, one of the biggest challenges for those private landowners has been water. So we need to try to identify whether or not there's water capacity, and if so, how we can get that resource available so that these private landowners can help out the members in their community who need it. But I'll defer to James to talk about any specifics on locations for Kohale.
Yeah, I think when Governor mentioned 26, that was the number of potential sites that we were looking at. I think we'll be happy to get a dozen out of those 26. And site selection really depends on a couple things. One is just the feasibility of creating a Kohale in that space. There are some places that lack infrastructure. There are some places where access is more difficult. And ideally, a Kohale is close enough to services and employment and the rest of the community to really be part of a community. I mean, I think an important feature of Kohale is it feels like a community and that people feel like they belong as part of a wider community. So the physical aspect is one. And then the other is finding community partners that are willing to take on aspects of Kohale development and Kohale operation. And the state is not, as I mentioned earlier, the state is not going to be the lead on these Kohale. These are going to be partnerships, ideally, with community organizations who help construct the Kohale and community organizations that help operate the Kohale in the long run. We can bring tools to the table, we can bring resources to the table, but it's really going to be those community partners that create the space and then ensure that the folks who live there feel welcomed and feel like they are part of the wider community.
And just to stay on this, James, when you're looking at a community and trying to find these potential sites, you mentioned some of those setbacks, and Nani also mentioned waters as another thing that could play a role into determining if a site is capable of housing these areas. We spoke to Council Chair Tommy Waters on this program about Kohales, and he spoke specifically for his district, which of course runs through Waikiki going into the Kahala area in Hawaii Kai, and mentioning that there's just not a lot of land in his district and a lot of availability for something like this to be set up because it is so densely populated. But there is a need. He mentioned the homeless camps that are on Diamond Head and the homeless people that are now moving more into the communities. When presented with those types of situations, especially like say for this neighborhood that Council Chair Waters represents, how do you then navigate through those obstacles, knowing that this is a community that needs it, but maybe doesn't have the space of other locations?
Yeah, I think, we're going to have to be creative. And it's not just looking at, as I mentioned, it's not just looking at open land for tiny home villages. We are looking at buildings that are underutilized or unutilized that can be repurposed. There's quite a bit of vacant office space right now in the marketplace. There are also former dormitory buildings that can be repurposed. So I think for places in the urban core where it's true land is scarce, we'd be looking at those kinds of solutions. I think the other big obstacle is NIMBYism, a not in my backyard opposition to projects that are designed to house people experiencing homelessness. And so to get past that obstacle, that's where those community partnerships are really critical. We want the whole point of having resources and these tools, the state having these resources and tools, is to find people in the community who have a heart to say, you know, I'm part of a church. We have access to some land as part of our church property. I'd like to put a Kohale here. When we find partners like that, we want to equip them with resources and tools to make that easy for them to do and to support them. Again, whether it's a faith-based organization, a community group, we have examples of this already popping up, pre-existing, right? Auntie Blanche McMillan with Hui Mahiai Aina in Waimanalo and Twinkle Borge and Puhono Owainai. We want to support those kinds of people and partnerships and the folks that bring that spirit to the table.
Yeah, I mean, on that subject of NIMBYism, but Butch Sullivan here has a comment that I just want to bring in. He says, I'm glad there's finally something being done to help these homeless people and their needs. Everything that affects them eventually will affect the rest of the population. So that is a very sort of yes in my backyard attitude. But Nani, if you could talk a little bit about those community conversations and how you really get the community to accept this as part of their neighborhood, because there will inevitably be some pushback.
Yes, I think James probably had a little bit more experience with that aspect of our Kohale than I do. Really, the people who are reaching out to me are people who want to have it on their property. And for the most part, I would also say they live in areas where there is a lack of existing shelter options or no shelter options currently available. It's a bit of a different story. James has much more of a direct, I think, connection to some of that NIMBYism feedback that we have gotten, as well as some of the YIMBYism. So I'll let him speak to some of the work that he and Governor have done to address those concerns.
Yeah, sure. Just to bring it back to those two examples I mentioned of Pu'uhono Wainai and Hui Mahiai Aina in Waimanalo, that's why the community partnerships are so important. I mean, in Pu'uhono Wainai's example, Twinkle and her leadership team, they are of the community. They're known in the community. They're respected by the community. And they still faced NIMBYism when they were purchasing their land for their permanent home. But because they're members of that community already, they could, they said, we'll be held accountable for what happens here. And they could work to build that trust and relationship with neighbors. And same for Auntie Blanche in Waimanalo. Her Kohale is behind her house, and she was the one to go out and advocate to neighbors. So those community partnerships, those community partners are really critical. And I would say the other way to help to open people's minds and hearts is to bring people who are experiencing homelessness into these conversations. It's people, I think, default to a place of fear of the unknown. But when you're sitting across the table from someone who's telling you, I'm going to live in this space, I'm going to be your neighbor, and here's the kind of neighbor I intend to be, that can dial the fear down and again, create that space for opening of hearts and minds.
Nani, I want to ask you, as someone who has worked on several of these projects, these Kohales in the past, what have you seen from the individuals themselves who are now calling this place home? Have you been able to see some success stories of people who move beyond there? Is there an average amount of time in which these individuals are living in some of these Kohales? What are you seeing based on what you've done in the past with these projects and the success that it's had so far?
We have seen some folks that have been placed into other housing options and permanent housing options. But I think that the majority of people have stayed, which is really, really nice to see. They've stayed, they've been a part of growing that community into something that they're proud of and they want to be a part of. I think as long as at Kama'oku, there is a rent requirement. I'm not as familiar with the details of Hui Mahiai in Waimanalo and if Auntie Blanche, if there's any rent requirement there. But I think at Hui Mahiai as well, they've been very long-term residents who move to the Kohale and then stay. And again, I think that just speaks to the success of being able to build a sense of community and build community itself amongst those residents.
Yeah, James, if you could talk about that, you had spoken on this program before and today as well about this whole concept of deeply affordable housing. And I think that there can be a misconception that Kohale is just another kind of a shelter. Can you talk about how this is different?
Yeah, so these are not intended to be temporary or transitional spaces. They're designed to be home for as long as you need it and to be a deeply affordable home. And I think that distinction is important because we need a range of affordable housing, certainly. But for folks who are trying to avoid homelessness or escape from homelessness, we need units that can be afforded at a very low level of income. And so, we're talking about targeting a range of $500 per unit per month in terms of rent and sustaining rents at that level for the long term. Now, the challenge is it's really expensive to build housing and to operate housing. And so, even some of the housing that we build that's intended to house people experiencing homelessness, it ends up being too expensive for them to afford. A lot of folks on the street may have limited opportunity for upward mobility in terms of their income. They're not going to double or triple their income and be able to afford something in the marketplace. So that's where Kohale come in. Deep affordability, we hope, will come from communal design that brings development costs down and communal operations. Again, with people taking responsibility for taking care of the space and of each other, you can avoid costs that tend to be big line items in an operating budget, like security, like groundskeeping, like repair and maintenance. You can bring those costs down, and those savings can be passed along to residents in the form of those deeply affordable rents.
Nani, I also want to, you'd mentioned the collaboration that you're having with city officials, and I just wanted to get a little more your thoughts on just this partnership that needs to exist between the state and the city. Because in the past, as we discussed this issue that has been going on for some time now, we've often seen how things get punted around based on who owns what land and who's responsible for dealing with certain encampments. How are you working with the city on some of these on this issue and moving forward? How do you see that partnership being important to the success of Kohales and others moving forward?
I think in a very one easy word is I'd say I think we're very efficient in working with the city administration and the city and county of Honolulu. The other counties have been great as well in terms of communication. Ryan, and I think I would like to, if James, you're comfortable with it, share with them the example of Middle Street, because I feel like that, could have turned into something that took 6, 7, 8 months to resolve. But James took care of it pretty quickly and figured out what we're going to do with the land and next steps. James, would you be comfortable sharing the Middle Street Kohale location potential?
Yeah, sure. This is one potential Kohale site that we're evaluating, and the state and city had been talking about different uses for it going back a couple of years. And I think what Nani is pointing to is just the fact that we have a really solid collaborative relationship with the city administration. And so I expect we'll partner on multiple Kohale. In some cases, the city may have land and need resources. In other cases, we may be bringing resources to the table and they have a contract with a community partner. But when I said every Kohale we hope is a partnership, it's not just a partnership between state and nonprofit or community-based organizations, but also partnerships with the counties and community collaborators. So that's one example.
Yeah, and tell us ideally how many units are in a Kohale? Like how many people are actually living there? Is it, I mean, the land is finite, and I know it depends site to site, but ideally to make the cost savings that you were talking about, to make these deeply affordable, what is sort of the threshold? What's the ideal size?
It will vary widely, but we're aiming for a median of 50 units per Kohale and the ability to house 75 people on average. And again, some Kohale may just be a dozen units, and others may be 100 or more. It'll depend on the site and the community and the partner, but that's what we're aiming for in terms of the average across. And the goal is a dozen Kohale over the course of the next 3 years.
And I'm not sure would specifically answer this question, so I'll leave it more open-ended. But with this site that's coming up across from Queens Hospital, what are some of the determining factors of who will be able to be in that space? Who ultimately is making those decisions? Because there are obviously only a certain amount of them available, and the need could, surpass the amount of availability overall. So how is that criteria determined?
Well, the need will almost certainly surpass the available bed space. In talking to urban Honolulu hospitals, there's probably on the order of 200 individuals discharged monthly into homelessness who would benefit from some form of medical respite. The hospitals and Project Vision Hawaii are working closely together to determine who will be eligible for these bed spaces. And it'll be people who are generally ambulatory and need maybe just a little bit of assistance, but who will benefit a lot from just having a safe, clean, sheltered space to continue their healing and recovery. Patients with a higher level of need who need a skilled nursing facility, they're not going to be a good fit for this Kohale. But we're going to serve the need and the segment of the need that we can. And I think in doing that, we hope to kind of highlight this issue of how desperately we need that space for people to be healed and to continue their healing. We have a shortage, again, a desperate shortage of that kind of space and virtually every kind of other space to serve or house people experiencing homelessness right now.
Yeah, Nani, I'm interested. We're almost out of time, but as you're making this, pitch, if you will, and you're talking about this with people that you work with throughout the community, what gets you excited about the Kohale concept? What do you tell people about why this is a good path forward?
Well, definitely there's this, practical side of it being affordable. But I really love the idea of using the built environment to create community, creating some beautiful spaces for people to gather, and just bringing back that sense of Hawaii and aloha that I grew up around, where you knew your neighbors and you watched out for your neighbors. And if you knew it was, trash day the next day, you took your neighbor's trash can out to the street for them. And this was way before we had the green bins and blue bins and all that stuff. So, I think Kohale to me really brings back that sense of community that a lot of us grew up with. And I think that taking care of our neighbors who are the most vulnerable, it's an important value for me. So I love sharing that message with folks. And when it resonates with people and they step up and want to also kokua and be part of the solution and helping us help our neighbors, that gets me really excited.
And James, we'll give you the last word here. Your final thoughts and message to those watching. Maybe some out there who may be still skeptical about Kohales, and we talked about those who maybe do not want to see this in their neighborhood. What is your message to people of why this project and this path forward is important?
I think maybe to build off of the question that came in from a viewer, these are intended to be deeply affordable spaces, and right now they're serving people experiencing homelessness. But the truth is, we have an affordability issue, a challenge of housing costs and a cost of living that is rising way out of reach for many of our people, especially those on a fixed income or limited income. And at its best, our hope is that Kohale demonstrates that if you can get back to, as Nani said, living as a community, taking care of each other, taking care of the place, that can be a way forward to produce these affordable spaces for people to live and heal and to grow. And in the future, not just for people experiencing homelessness, but for many more of us who need those kind of spaces.
Okay, well, James Koshiba and Nani Medeiros, thank you so much for really diving deep on the Kohale concept this morning and explaining it all to us. We really appreciate it, and we hope to have you back again soon.
Thank you. Mahalo.
Thank you.
Very interesting, Ryan, to hear. And if you haven't had a chance, folks, to drive by Queens and actually take a look at the units themselves, it is very interesting to see. They have brightly colored doors. They're right across the street from the hospital, and we are told that they will be taking on folks hopefully by the end of the month. The need out there, as we heard today, is so great for folks who are being discharged from hospitals throughout our area and don't have a place to go and fully recover. Longer term, though, Ryan, I mean, this is something that is a really big priority of the governor and the legislature agreeing, giving $15 million for the first year, $33 million for the second. Undoubtedly, we will see a lot of these to come.
Yeah, and we also heard maybe some of the differences of what this specific project that's happening across from Queens Hospital might be different from the other Kohales. James saying specifically that this is a location that will be temporary, that they are looking for more permanent solutions to help those individuals who are coming out of the hospital who need additional resources and care, looking for other facilities, whether it be medical facilities, hospitals, office spaces, even things that can help to house these individuals while they transition out of some of their medical conditions, and ultimately do away with the setup that they have currently working on, located there on Punch Bowl, but also long-term looking for those other communities where the Kohale fixture and motto can be a more permanent fixture within the community, but also recognizing that there may be pushback, but the importance of community partnership and finding individuals who are really going to help to take that on and welcome these people and this plan of these neighborhoods in their own community.
Right. And to be clear, this is a very different thing than having a homeless shelter in the community. And that's a distinction that we heard again and again, that this is deeply affordable, permanent housing. This is not necessarily someplace just to stop on the road, although it can be for folks who want to go there and then get on their feet and move somewhere else. But that this is creating community spaces, shared kitchen, shared bathrooms, those spaces, which also lowers the cost for these builds. And then having that private space that people can live in for very, very little. Hopefully, they're hoping for around $500 a month, and then wrapping around social services there as well for those folks who need it. So it's a very interesting concept. We're expecting to see it statewide, and we appreciate them coming on this morning and talking about how this is really part of the wider plan to make Hawaii more affordable for everyone who lives here.
Yeah, and it is a topic, again, that we've been discussing for some time now, and we've seen the success so far with some of these other Kohale villages that have been set up. And interesting to note also when hearing from Nani that many of those residents who have found their way into these homes are actually staying there and that they are building this community. And so this is something that has somewhat of a success and proven track record to work, and can see why the governor and this administration is making this a priority and something that we will continue to look into and follow up as we move through.
Another priority that lawmakers set out this session and the last is bringing early education to our keiki in Hawaii. The Ready Keiki program and others are trying, they're trying to get early learning available. And so we have two experts in that space joining us on Wednesday to talk about what exactly was allocated, how much money is going to it, and what we can expect to see, when we can actually start to see some results. We're going to be talking to the folks from HICAN. They are a community organization that really works to advocate for access for kids. And so we're looking forward to that conversation. We hope you join us right back here on Wednesday.
We'll see you then. Aloha.